Time now for Morning Rounds. With us are CBS News contributors Dr. David Agus and Dr. Holly Phillips. First up this week, a new, faster test for enterovirus. It gets results in days instead of weeks. 46 states and the District of Columbia now have confirmed cases of enterovirus D68. The virus causes respiratory illness. It's being investigated as the cause of at least 6 deaths. David, why is it so important to get this quicker test?
Well, this virus is different than the classic cold that you get during the cold season. The cold takes a couple of days, you get sicker and sicker, and then if you get really sick, you go to the pediatrician. This virus, 0 to 60, is in less than a day. And so pediatricians, the front line, need to be able to test this to know whether to really go for aggressive supportive care in these kids. And so it's going to be key as we try to contain it and stop it from spreading among kids to identify it.
Holly, we talked last week about the possibility of a connection here between enterovirus and paralysis. Is there a firm link here that we know about?
Well, we do know there are 27 patients, both children and adults, who have tested positive for this enterovirus and also experienced some symptoms of muscle weakness and even paralysis. What we don't know definitively is whether the enterovirus actually caused those symptoms. But I will say it's plausible. We know that viruses can affect our nerves, and another enterovirus, poliovirus, also causes paralysis. So it's something where we have to really further define the link, but in the meantime, it's all about trying to stay healthy and avoiding it.
All right, also, as we showed you last week, 29-year-old Brittany Maynard is starting a national conversation about choosing the way to die. Maynard has terminal brain cancer. She moved to Oregon, where doctors are allowed to help patients end their lives. In her first TV interview, Maynard explained her choice to Jan Crawford.
I don't want to die. If anyone wants to hand me like a magical cure and save my life so that I can have children with my husband, I will take them up on it. But we haven't been able to find that. And the way that I would die, just according to this disease, is terrible. The availability of being able to take a medication that allows me to slip into a sleep in 5 minutes and pass away most likely within the half hour sounds a lot better to me, just as a human being.
David, what exactly does Brittany Maynard have, and what challenges does she face in the last few weeks here?
Brittany Maynard is a hero for talking about this publicly and bringing national awareness. She has glioblastoma, which is the most aggressive form of brain cancer. And so it really depends on where it is in your brain in each patient, because some patients are less symptomatic than others. But as it grows, you stop losing many of the characteristics of a human. You can't interact much. In her case, she may not be able to have the case of speech. She may have seizures, and she doesn't have the dignity that she wants.
Holly, there are currently, 5 states only which where aid in dying is legal. So what options does someone in her position have?
Right, arguably, we don't have enough options. There are medications and treatments that can lessen pain and alleviate some of the other symptoms as patients are dying. But just as with life, everyone experiences death differently, and they approach death differently. So for some patients, they feel like those methods don't allow them to keep their dignity intact, and so they want other options.
David, how does the medical community feel about this? So much effort is being put into finding a cure for cancer, so how do they respond to this whole idea?
Well, my job is to have an endpoint for the patient that matters to their value system. So my job is to make them comfortable. And it's a failure, right? It's a failure in that I can't treat her cancer well. It's a failure in that she's afraid that she's not going to die with dignity and she's going to have horrible symptoms. So we have failed her. And so we feel bad and we have to step up our game.
As we said last week, this is an extremely important conversation. New research shows a chemical in broccoli sprouts may help people with autism. Scientists studied 44 teenagers and young men who had moderate to severe autism spectrum disorders. About half the patients who took the chemical, sulforaphane, had noticeable improvements in behavior, communication, and social interaction. The effect only lasted as long as they took the chemical, which can also be found in cauliflower and cabbage. You might wonder what's going through your doctor's mind while you're being examined. Reader's Digest polled dozens of physicians across the country to uncover what your doctor is really thinking. I love the idea of this. One of the things they found was that, Holly, was the doctors polled said, I welcome your emails within reason. Really?
Exactly, yeah. You know, my patients know that I set aside time at the end of the day for email, so they don't ever send me anything urgent. But email actually is a very efficient way just to, answer a quick question, a follow-up maybe from an appointment, or how to take a medication properly. But when I get the 2-page emails listing symptoms and hoping for a diagnosis and treatment, then I just tell people, come in. We can't do it this way.
A lot of patients now, of course, Google for advice and second opinions. But doctors in this survey also said that second opinions help them too. Is that really the case?
Yeah, sure. Anthony, I call second opinions on myself all day. If I have a difficult case or a question, I will call a colleague or a specialist who's a friend. I also welcome patients getting second opinions, but they should know they don't have to make it secretive. It's not about pitting doctors against each other. If they'd like to see a specialist or get another opinion on the matter, we can use that information to help with their care or with their treatment. We can all sort of work together.
David, a lot of patients spend a great deal of time in the waiting rooms, but another thing that came out of this survey was that doctors want patients to know that they run late for good reason. Is that so?
Obviously we predict how long it's going to take in each case, but if something's more complex, if something happened in the interval, if it was you want me to spend extra time with you. And so I think there needs to be that respect bilaterally to know that if it is taking longer in that waiting room, it's because somebody else needs my time, and the same will happen to you.
Right.
So I think if there's that respect back and forth, we're all going to benefit.
All right. Finally, how long do you spend at the dinner table with your kids? A new study came out this week in the November issue of Pediatrics. The report shows the average family meal lasts 16 minutes. Researchers wanted to learn how family dynamics during mealtime relate to childhood obesity. Holly, what happened with this study?
So this was very interesting. They really wanted to see what aspects of meals, other than what you eat, what aspects have to do with childhood obesity. So they looked at 120 kids and their families, and they actually videotaped them during their meal times for a number of days. And they really focused on things like how long the meal lasted, how many people were at the meal, what the dynamics were, was it a positive dynamic or a negative dynamic, and what rooms people had their meals in.
That's really interesting. David, so why are shorter meals, why do they tend to be associated with obesity?
Well, we don't know the exact reason, but we as humans evolved as creatures to be social and have meals together.
Right.
So we would go out and make our kill in the wild. We would all eat our dinner at night and then the leftovers in the morning as a collective group and be social. And so I think we need to go back to that. The real message is that sitting down, letting your shoulders down, having a conversation is beneficial. And whether it be psychologically telling kids they care about me, I got to eat the right thing, or whether it be you focus more on what you eat when you don't have the TV going, I don't know, but whatever it is, we got to pay attention.
It's beneficial. It's even healthy, in fact. So, Holly, how do parents approach family meals then?
I actually found this study to be really encouraging because a lot of the things that prevented obesity are doable even in a really busy family.
Right.
So try and make the meals last 20 minutes or longer. Have meals only in the kitchen or dining room, not the bedroom or living room or some other place.
Or in front of the television.
Exactly. And really the biggest correlation was to keep the meals positive. So if you have to resolve some conflict or have an argument, try and save that to after the meal. Keep the tone of the conversation as positive as you can, and it cuts down on kids overeating.
Yeah, you avoid food fights that way, too.
Indeed.
Dr. Holly Phillips.
That takes all the fun out, though.
Dr. Holly Phillips, Dr. David Agus, thanks so much.